Welcome to the Egg Whisperer Show. I'm so excited to have one of my favorite OB-GYNs in the entire world on today's show, Dr. Justin Thompson. Hi, Justin.
Hi, good morning, Amy. Thank you so much for having me.
Of course. So, you and I go back and forth a lot about the patients that we share in common, and you really treat my patients like the VIPs that they are, to me especially. So, when I say VIP, I mean very important and precious pregnancy. So, thank you for all you do to make my patients feel so special and cared for as they progress in their pregnancy.
Well, thank you. I've had the honor of delivering many babies and helping many patients that you've helped. So we've had many mutual patients over the years, and it's a huge honor to be here with you.
Yeah. And one of the things I learned from you, and also just from the experiences my patients have, is as you know, I'm all about the mnemonics. I'm always like the Tushy method, the Balls method, all that kind of stuff. But with the Tushy method, getting your tubes, uterus, sperm, hormones, your genetics checked, that's one thing. But you really need to have an OB-GYN ready to go even before you're pregnant, don't you think?
Absolutely. Yeah, I see this a lot. Over 50% of the patients I care for are patients who have done IVF to get pregnant. And for many of them, they haven't really thought about finding an OB-GYN until after their embryo transfer.
Right. And they should really do it from the start. So it should be OB to she method.
Yeah, I love
So the topic of today's show is an OB-GYN's journey of inspiration, passion, and patient care with you. And I just want to share with our listeners more about you. Dr. Justin Thompson is a board certified OB-GYN. He grew up near Philadelphia, Pennsylvania, where he developed a love for sports and the outdoors. Initially focused on cycling, he earned a spot on the U.S. national cycling team. In medical school, Dr. Thompson planned to specialize in oncology, inspired by a gynecologic oncologist who treated his grandmother's uterine cancer. During his residency at Stanford Hospital, he discovered his passion for obstetrics, finding immense joy in guiding women through pregnancy and delivering babies. Now practicing in Palo Alto, California, Dr. Thompson is dedicated to providing personalized care, prioritizing health, safety, and positive birth experience for his patients. And I'm sure everyone listening can see why I refer my patients to you. So thank you again. So tell us more about the gynecologic oncologist who inspired you during med school and how their work influenced your decision to initially pursue oncology.
Yeah, it's so fun to think back to that very informative time in my medical training. I was a third year medical student, bright-eyed, bushy-tailed, and had no idea what I wanted to do in terms of a medical specialty. And I got to work with a phenomenal doctor by the name of George Olt in Lancaster, Pennsylvania. He's a gynecologic oncologist. And I, to be honest, didn't really know anything about the field before meeting Dr. Olt. The only thing I knew about gynecologic oncology is that my grandmother is a uterine cancer survivor. And she wasn't cared for specifically by Dr. Holt, but by a different gynecologic oncologist around that same time. And for me, I thought, oh my gosh, this doctor has amazing medical and surgical skills, and he's dedicated his whole career to getting better and having the best outcomes for his patients. And on top of that, he's helping amazingly wonderful patients that are people like my grandmother, everybody's grandmother. And I thought, oh my gosh, how could you ask for a better specialty to go into?
Yeah, absolutely. And I can see how her work continues to influence your work today. Tell us about that.
Yeah, I think the thing the thing about my grandmother and my mom that probably influenced me the most is I don't come from a family of doctors. And when you're the first doctor in your family, every single holiday, every single meeting, you hear another medical story from your family members. And for my grandmother, that goes back all the way to her first baby she had, which was my mom. My grandmother had 5 babies, and she could tell you about every one of those births like they happened yesterday. And it's just a great reminder that as doctors, we'll care for thousands of patients in our career. I've already delivered thousands and thousands of babies. I know I can't remember every one of those babies I've delivered, but for the patients we care for, they will remember the care we provided for the rest of their lives. And I see that every day when I talk to my grandmother and my mom.
That's so true. Unless you're the anesthesiologist, they usually forget them. My sister always tells me if they remember my name, because my sister's an
Uh,
anesthesiologist, something might have gone wrong. So it's a good
yeah.
thing. During your residency at Stanford, you realized that like obstetrics was clearly the right path for you. What was it about counseling and delivering babies that made you realize that this was your true calling?
Yeah, well, that's a great question because I went to Stanford thinking it was going to be just a little pit stop on my way to an oncology fellowship. And so I was, like many medical students, I just thought I had my whole life figured out, and thought, I'll go to Stanford, get great OB-GYN training and parlay that training into an oncology fellowship. And as you know, OB-GYN residency is 4 years. And I would say within the first 3 months, I quickly discovered that obstetrics was my true calling. And obviously, oncology is an extremely important field. But one of the fun things about medical training is you spend so much time in the hospital that you really got to listen to yourself and what really resonates to your core, because you have to be passionate about it if you're going to spend that many hours doing something. And so I quickly realized that I got this just great joy and energy from labor and delivery. It didn't matter if I was up the whole night delivering babies and caring for patients. I walked out of the hospital holding my head high and really excited to go back for the next shift. Again, I admire our oncology colleagues, but I didn't get that same energy from oncology, and really felt so privileged to help a patient on that journey to bring a baby safely into the world on, what for many people is one of the most important and special days of their lives. And I thought, wow, how lucky would I be to do this every day?
Yeah, truly. I mean, the day that I don't jump out of bed like a complete maniac to run to work to do an egg retrieval or to help another patient is the day that I'm under the ground and dead. Does that sound crazy?
Amen.
But that's the
I'm
truth.
with you,
I
Amy.
mean, if
Yeah.
I'm not jumping out of bed, when people are like, "Are you tired?" I'm like, "Oh, you don't want me to be tired," because that's not a good day. I have all the energy in the world, all the strength and ability. We were designed to care for people, obviously, and you just have such a lovely bedside manner. And not just that, just your ability to just act and react in stressful situations and emergency situations. That's what makes you so great. So, after a decade of practicing obstetrics, you decided to open your own practice. And tell us about that. What motivated you to do that? And how has it changed your approach to patient care?
Yeah. Like many of us, I trained in a large academic medical center and then worked for that same medical center. So I worked for Stanford University for a number of years. And I was very busy. And as the medical system often does with physicians, the goal is to get every bit out of you. And I quickly realized that the large corporate healthcare system and also the health insurance companies were really determining how much time I got to spend with patients. And I I love learning and I love new challenges. And I thought, I don't know if this will work, but I think it will. And I can't go my whole career without trying this, because I think there's a better way to deliver care. And that's why I went to med school. I think that's why hopefully all of us went to med school, was we envisioned ourselves providing this extremely high level of care. And I got to a point where I felt like the system was blocking me from that. And I said, well, it's not going to be the easy path, but I need to go on my own and see if I can do it.
Yeah, I mean, luckily I started off that way in 2008, but I know I was lucky because I had my father, my mom was running his practice. It was very easy. My dad bought the space. My mom plugged in the phones,
Uh,
got the TV set up in the waiting room, bought my credit card machine, helped me with my insurance contracts back then. So I can only imagine what a challenge it would have been to do it, you know, the way you did it. So hats off to you.
I feel like I had some great help in that department. I mean, my parents weren't physicians, but my mom helped me any way she could. She helped me decorate the waiting room and some things
Well,
with office
nice.
design. And I'm really lucky to have some great mentors. Dr. Nancy Mason
Yeah,
is a dear friend and mentor of mine. And she was a private practice OB-GYN in Silicon Valley for many years. So I think similar to kind of what you mentioned, is it's all about having really great people around you to support your dreams and your
absolutely.
goals. Yeah.
Your practice emphasizes building a relationship with your patients before delivery. Now, that's not common. I mean, so many patients, they never see, the doctor who delivers them is not someone that they saw once the entire pregnancy. And that's kind of the model that a lot of patients experience now. Why do you believe this is so important for a positive birth experience?
Yeah, Amy, I feel it's super important because of what I witnessed over a decade of delivering babies. I saw a huge difference when I saw a patient for every prenatal visit over the course of 9 months managing their birth. Not only did it make my job easier to have a healthy, safe outcome, because I knew the patient so well. I knew the patient's medical history, obstetric history, and I knew their goals for their birth experience. So when you walk into labor and delivery with all that knowledge about your patient, compared to the on-call physician who reads through a patient chart for 2 minutes and then walks in a room, I felt this huge advantage. It's almost like I had the cheat code to providing the best care possible. And I saw that my patients really felt safe and supported because of that relationship. And I will be completely honest that it is also extremely beneficial for the doctor. We know a lot of OB-GYNs, and I have a lot of great colleagues that work in the, like you said, the traditional setting where they do shift work and they don't get to establish relationships with patients. I feel extremely lucky. It makes my job so much more fun, so much more rewarding. I'm not going into the hospital at 3 a.m. to deliver a stranger. I'm delivering a great person who is basically a friend that I've gotten to know over the course of 9 months. And so I feel so lucky to be able to practice in that way.
Yeah. And I've had patients move states literally to get care from you.
Yeah.
So,
Yeah.
I mean, I've had patients move from one city to the next. I mean, literally like uprooting their
Oh,
lives just so that they can have you
yeah.
be their OB-GYN.
I think, yeah, something that to my core, I love what I do. I think the opportunity to practice obstetrics, it's my calling. I can't imagine doing anything else. Professor Galloway, someone who I follow, he says, do something you're good at. Find a passion that you're good at, and it just really makes it work. And then you just want to get better and better at it. But I will never believe that obstetrics is a commodity. I think that it's so sad to me that we're telling women just go to the hospital when it's your time when you go into labor, when you want to have your baby, just go to the hospital. And no matter who's there, you'll be fine. There's a lot of great doctors, but we know that no matter what the field, whether it's fertility specialists, surgeons, even other fields, tech, law, these are not commodity fields. There are people that are really great at what they do. Like you said, you wake up every day smiling, happy, and want to get better at what you do. And I think patients deserve that. I don't think we should just make them feel that it doesn't matter who it is and it's all the same.
Right. I agree. So, what advice do you have for couples or individuals who are just beginning their pregnancy journey?
Yeah. I encourage all patients to really treat this process of finding an obstetrician or a group seriously. You're not apartment shopping, you're not going car shopping. This is a bigger decision than the house you're going to buy, right? This is the health of a woman in one of the most exciting, but also can be a very medically dangerous situation, depending on how things go. The health and birth of a baby. And so do your due diligence. If you have one prenatal appointment, don't be afraid to go to another group or doctor and say, hey, we want to meet you and get your opinion. Ask questions like, what's your obstetric volume? Do you plan to deliver my baby? How big is your group? How many different providers are in your call group? It's a really, really big decision, and patients shouldn't be afraid or feel like they're a burden to the healthcare system if they want more information or want to meet multiple doctors.
I mean, I would say up until about maybe like 6, 7 years ago, it was really common for people to make meet and greet appointments with OB-GYN practices when they found out that they were pregnant. But now the obstetrics practices won't even set up those appointments anymore.
I've been hearing that.
It's just such a different world. What they'll say is like, you can set up a new patient appointment, but we don't do meet and greets. And that, it's a different time. So, if you want to do those meet and greets, you should do them before you're even pregnant, making sure you're establishing care at a clinic you feel really comfortable with. Do your research way in advance. Don't wait until you're pregnant, because they might not even schedule you for your first OB appointment until you're 12 weeks pregnant, is what I've been seeing.
Yeah, that's a great point.
How do you ensure that each birth experience is as safe and positive as possible for both the mother and the baby?
I start by limiting how many patients I accept, Amy. I know that, even if I try to be Superman, there's only so many hours in a day. And so the first step to ensuring a healthy, safe birth experience for my patients is not being overburdened with too many patients. So I pay close attention to how many due dates I have each month, how many total patients I have under my care. And so that's number one. The other thing is, like we've kind of talked about, is knowing your patients and knowing what their goals are. For me, that's the key to a healthy and positive birth experience. And that can, as you know, can be vastly different. You could have 10 pregnant women and they all have slightly different goals for their birth experience. And so going into that, knowing what their specific goals are, then being at a place like Stanford Hospital that has, all the resources if needed, evidence-based medicine to ensure that we're following guidelines and being safe. And then the final one is actually paying attention to the birth experience. And this is something whenever I work with medical students or residents, I try to explain that even if as a doctor, statistically what's the safest thing in this decision, how you deliver that information, helping a couple feel empowered so that they feel that it's a shared decision-making process, that keeps everybody safe, but also, it makes the whole experience positive. And one of the things I want to highlight is I hear upsetting birth stories from folks all the time. And I hear these situations where there was no communication between the patient and the doctor throughout the whole labor process. The doctor zooms in the room and says, we have to do an emergency C-section. Now, we all know that there are obstetrical emergencies where there's no warning signs and things can happen extremely quickly. But I would argue that the majority of the time, there are signs far in advance, many hours in advance, that maybe things aren't going quite how the patient had hoped, and we need to talk about different options to manage labor. I love going in the room when it's not an urgent situation, pulling up a chair, talking to a patient and saying, hey, we really hope to make some progress in terms of, say, cervical dilation, or, we're watching your baby's fetal heart rate very closely. And if this were to continue over the next hour or two, we might need to think about other options. It allows a discussion, a conversation. And, back to when patients are looking for OB doctors, sure, you can ask them about your C-section rate, but ask an obstetrician about their emergency C-section rate. Because I think a good obstetrician that is really paying close attention to a patient's labor progress and watching all the signs and information we have and communicating with the patient, that should be a very low number of these emergency last minute situations. And I think that would help prevent birth trauma and improve the experience for patients.
Yeah, that's so important. I mean, I have this thing called the Sparkle checklist. So every time a patient comes in, and I use this for patients who are not my patients so that they know what to ask as they're going in for their monitoring visits at their fertility clinic, right? So the size of the follicles, the protocol you're going to follow, am I happy? When's the retrieval going to be? How does the lining look? How do my estrogen levels look? I almost feel like, Justin, you have to come up with something like that where patients can ask, like, what's the size of my baby? Am I making progress? Are you happy? When do you expect the delivery to land? How do my labs look? So I feel like patients should have that very short checklist where they can just ask those questions, and they should know that they own this information. It's information about their own body, and it's so important to have. So come up with that.
Okay, sounds
Okay.
good. I'll work on that. You have to have me back for round two so I can present.
Absolutely. Are there any things that you think about for your IVF patients that would be different than a patient, let's say, that didn't go through IVF as far as pregnancy management?
I think it starts from the very first appointment, recognizing that a lot of my patients have had a really, really challenging journey just to get to my office pregnant. And so I think taking that into account and just recognizing that for any person who has had a challenging or stressful journey, knowing that ahead of time really it allows me to, right from the get-go, help establish rapport and make a patient feel safe and supported. And I think, to your point earlier, that's very different than the common clinics nowadays, where it's like, hey, oh, you're pregnant, doesn't matter how you got here, and we have a 20-30 minute appointment, let's go from there. So I think that's number one, is just taking that into account. And so making longer appointments, visits, explaining things, addressing specific questions, concerns. Patients who've had a challenging fertility journey have had to get creative, maybe even all the way, prior to pregnancy, right? Just to get pregnant. And so they ask lots of good questions. Many of them know about pregnancy guidelines, but they say, hey, what about this supplement? Hey, what about this option? And so I think taking the time, and there are no stupid questions at a first prenatal visit, right? And saying, hey, that's a great question. Sure, we could think about that. We could consider that. That's number one. The other thing I'm a glass half full kind of guy. I think anyone that knows me, any of my patients that I've cared for, know I'm a positive guy. And so sometimes patients come in really well informed. They say, hey, I'm a high risk pregnancy for this reason, I'm an IVF pregnancy. And I'd like to reassure them and tell them, hey, you're my normal patient. I'm an OB-GYN in Palo Alto, California. My patients range in age from 28 years old to 48 years old currently. Over 50% of my patients are IVF. So I like to look my patient in the eye and say, we got this. You're my normal patient. And yeah, there's some things we're going to do extra. We're going to do a fetal echocardiogram at around 20 weeks, which is standard of care for IVF pregnancies. We're going to do some extra fetal monitoring in the third trimester, make sure you're healthy and safe. But I like to be positive and bring that stress level down, instead of saying, oh my gosh, your advanced maternal age, your IVF pregnancy, oh, this is such a high risk pregnancy. Well, no, this is how women are having babies nowadays.
That's so true. What are your hopes for the future of the field of obstetrics just for the future?
For my practice, I'll tell you that I want to just get better every day. I love the idea of having the autonomy to try to make the patient experience for my patients incrementally better. I have goals, but at the same time, I want to do what I'm doing, where I'm doing it, hopefully for, knock on wood, the next 30 years. I want to be that little old OB-GYN in Palo Alto. My goal is just to say every day, how good can we make it? How much better can we make it? But for the field of obstetrics, that's where I really hope, gosh, I mean, there's so much room for improvement. And I hope that the field of obstetrics, I hope that we can pay attention to things like patient experience. I don't know if we need to make patient experience like maybe it needs an ICD-10 code. And then maybe doctors will pay attention to it, but it's not even part of really medical training to any significant extent. And so, why are women interested in home births? Why are women feeling so much pressure to surround themselves with birth doulas and a huge amount of support staff? It's because the healthcare system is failing them. Many women don't feel safe and supported with a hospital birth. And so the answer is not to just convince women that that's where they should do it. It's to provide safe, effective care. And I hope that the field of obstetrics embraces that challenge.
Yeah, it's heartbreaking. Some of the experiences patients share with me, just listening to them, knowing that so many things could have been prevented and the outcomes could have been different in some situations if people just paid a little bit more attention, listened a little bit more, things would have turned out better for them. So it's nice to know that you're doing what you're doing. And hopefully other OB-GYNs will model. Obviously, not everyone has the energy and capacity for what you and I do as it comes to extending ourselves. Like there are a lot of people that like to be off at a certain time and not have patients call them on their cell phones. I mean, I imagine you give your patients your cell phone number.
Yeah, every single one of my patients has my cell phone number. But I have to say, I don't think it's a coincidence, Amy, that you and I really connect with our patients and we want to provide the best care possible. And we're probably also the least burned out physicians you'll ever meet.
That's the thing. Everyone tells me that. They're like, "Aren't you burnt out?" I'm like, "From what?"
Yeah.
From just showing up every day and just trying to make sure each patient knows how important she is and know how loved she is.
Mhm.
Like that's burning me out? No.
Right. Yeah.
Totally. So
It's the opposite. It's invigorating. It gives you energy. I'm like you. I wake up every day and I say, great, I get to go to work. I work 7 days a week. I mean, I'm in the office 4 days a week, but I'm thinking about my patients, responding to messages, checking on lab results every day. And as I know you are, and I wouldn't have it any other way. And if you look at the rate of physician burnout, and I believe it is closely correlated with physicians being shift workers. I think that if you take on a little more work and extend yourself a little more professionally to your patients, it has huge positive impact on your feelings about your work.
I agree. Yeah, but people can't believe that I give my cell phone number out, but people even get my home address. For those who have a hard time with their shots, I'm like, come on over.
Oh, yeah.
Or I'll go to you. I'll drive to your
Well,
house.
I'm just
Yeah.
so happy that patients have you for this important journey,
Oh,
and
same.
yeah, it's such an honor and a privilege when you help a patient with that first part of the journey. And they come to me and they say, and I'll be honest, sometimes they come a little guarded. They say, Dr. Amy recommended you, but I don't know. I don't think anybody could provide, really great personalized care like she does. And I say, oh, that makes me so happy because I know I'm going to do everything I can to make them feel just as safe and supported as you made them feel.
Yeah, I mean, I tell them Dr. Thompson's like me, but a guy. I mean, you're basically getting the same person showing up for you, but after 10 weeks of pregnancy. So I know they all have a great experience after they meet you,
Well,
for
thank you
sure.
so
For
much,
sure.
Amy.
So tell us how can people find you? How can they make an appointment with you?
Yeah, we have a website. It's dedicatedpregnancycare.com. Patients can learn more about our practice. You can even send us a message through the website. You can send us a message to make an appointment that way, or you can call the office. We were really good at getting folks in very quickly because, again, we limit how many patients we accept each month. I love that you mentioned the meet and greet. That's something that we do for every single prospective patient. In fact, we don't really give you the option of just establishing care. We want to meet you first. We want to make sure it's a good fit. We want to make sure that that I can provide the type of care that the patient is interested in. So yeah, that's a requirement is, hey, let's spend 45, 60 minutes. Let me go over your medical history, answer any questions you have about pregnancy, my style of care, my practice, having a baby at Stanford Children's Hospital. And if it's the right fit, then great, let's get rolling.
Well, thank you again, Justin. Thank you for your time today. And thank you for doing what you do for women and
Well,
families. I
right back
appreciate
at you, Amy. Thank you so much for having me, and look
it.
forward to talking to you soon.